Hello, my name is Rebecca Landsman, and I am an internal medicine resident at Rush University Medical Center. Today I would like to discuss an interesting case, numb chin syndrome, and a case of diffuse large B-cell lymphoma. A numb chin may not sound serious, and it is often a symptom that is disregarded. Here, we report a case of diffuse large B-cell lymphoma presenting with numb chin syndrome, with no evidence of metastasis in brain parenchyma, CSF, or mandible. Let's dive into our case. A 40-year-old healthy woman presented with a 7-day history of sudden onset left chin and left lower teeth numbness. She had no associated aggravating or alleviating factors. A recent dental examination 3 months prior was unremarkable. She was doing physical therapy for a low back strain that was improving. She had no significant past medical history. Her physical exam demonstrated a symmetric face, normal cephalic, atraumatic without obvious dental caries. She was alert and oriented ×3, and cranial nerves 2 through 12 were significant for decreased pinprick sensation on her left lower chin, lower canine, and incisive teeth. She had normal sensation of her gums and cheeks. She had 5 out of 5 strength in upper and lower extremities, and 2+ reflexes symmetric throughout. The next steps were we ordered a MRI brain which demonstrated no abnormalities. We referred her to neurology for further workup. She then presented to the ED about 2 weeks later with acute back pain. A MRI thoracic spine demonstrated a marrow-infiltrating lesion. The picture you see on the left showed her initial MRI brain that was unremarkable in the workup of her numb chin. The image on her right showed the thoracic MRI that was ordered in the ED when she presented with her acute back pain. The red arrow points to a marrow-infiltrating lesion. The next steps involved a biopsy of paraspinal soft tissue that was positive for diffuse large B-cell lymphoma. She then established care with hematology oncology and had repeat MRI brain with and without contrast, as well as CSF studies that were negative for lymphomatous involvement. The PET scan did not show any lesions in the mandible. Numb chin syndrome. It is a numbness or decreased sensation of the chin and lower lip. There are many different etiologies of numb chin syndrome, which include malignancy, inflammatory conditions, medications, toxins, post-vaccination, or dental and surgical interventions. The mechanism of numb chin syndrome is thought to be from either a lesion along the nerve, lymphadenopathy exerting pressure on the nerve, or from a paraneoplastic process thought to be from autoantibodies against an unknown antigen in the nervous system. In some cases, clinically and radiologically undetectable mandibular metastases or marrow infiltration are present. So what can we take from this case? What we should learn is that we all need to take a numb chin seriously. If you are uncertain of the etiology, imaging must be ordered. Ultimately, the treatment of numb chin syndrome is focused on treating the underlying cause. Thank you so much for listening to my presentation.